Greetings to all viewers. I'm Dr. Shobana Mohandas. I'm a gynecologist practicing in Thrissur, Kerala. Today, I would like to give my viewpoints on exercise in pregnancy. It's somewhere in between taking full rest in pregnancy and some taking too vigorous exercises all the time. That is advocated in the Western world. So we have to find a way in between. That's what I feel. In the earlier days, they used to say, take rest. And well-meaning aunties and grandmothers will come and say, "Oh, you be slow, take rest, be slow, be slow." But all this rest is going to have result in deep vein thrombosis, mental stress, and you know that mental stress in the pregnant woman can lead to ADHD in the baby, neural deficits. So it's very important that a mother is always happy in pregnancy. So exercising is going to bring on that, and taking rest and brooding is not going to be good for you. How to sit in pregnancy? It would be good if you can put a towel or pillow below you, below where you sit, because your hip will be slanted, and that slanting will make it easier to get up and plus avoid aches and pains. While sitting, it also helps to put a pillow behind the back that will release the stress on the back and prevent backaches. Sitting cross-legged is the done thing in all the places in India, but it may cause pressure on legs and ankles, pain in knees and hips may increase. Getting up may be difficult and can cause strain on the back. So too long sitting cross-legged, not good. Something close to that is but good. The Baddha Konasana of yoga, where you put your feet side to side and put your foot together and keep pushing up and down at the knee, changing your hip. It loosens the hip joints as you get ready for labor, easing the tension on your back. You can start from the first trimester, go on right up to the labor time. Second trimester, third trimester, throughout pregnancy, you can do this. It should be done only if the woman is fully healthy, if the fetus is fully healthy, and then you can start regular physical activity. It will actually improve posture, build stamina, relieve stress, mental stress, may prevent even diabetes mellitus that comes on in pregnancy, prevent digestive problems like constipation, gas, and bloating, minimizes aches and pains because you are exercising your body and keep improving your stamina. So all these things are good if you exercise. But if you have severe anemia, chronic bronchitis, morbid obesity, extreme underweight, or if the baby is having growth retardation, you should not be doing it. Or if you have poorly controlled diabetes, hypertension, the diabetes should be the ones which comes from childhood, the type 1 diabetes, or thyroid disease, or you have epilepsy or fits, which is uncontrolled. Or again, if you have severe heart disease, restrictive lung disease, where the lung is smaller in size. If you have incompetent cervix, where the cervix is loose and tends to, give way, and all a stitch has been put on the cervix, those women should not be exercising. Multiple pregnancies, bleeding or, discharge in the vagina, pregnancy induced premature labor, which comes on at 8 months and 7 months. So they should be taking rest. Or if there is some leak of the waters, which is called premature rupture of the membrane, which comes like urination, clear water comes. There you have to take rest, not exercise. Pregnancy induced hypertension, again, you should not be doing exercise. Another thing is, there is a hormone called relaxin which comes in the body, which increases in pregnancy. So it will allow you to overstretch, when you're doing yoga. And overstretching can cause injuries. So you have to be careful to remember to stretch slightly less than pre-pregnant levels. Now is not the time to push hard. For a normal delivery, you have to do exercises, but avoid tiring exercises. Gentle exercises are permissible. This is in the first 3 months of pregnancy when you are feeling tired all the time because of nausea. Whenever you learn to exercise, do exercise, drink a lot of water, wear loose clothes, take a cool area to do things, lighted area, and relax and do your exercise. So take precautions and stretch slowly when you go to higher. Warming up is necessary before the exercise. If you have problems, take a break, especially like nausea, feeling hot and sweaty, dehydration, vaginal discharge or bleeding, abdominal or pelvic pain. Take a break till you're okay and then only restart your exercise. The best thing to do is walk, walk for 30 minutes, maybe 10 in the morning, 10 in the afternoon, 10 in the evening. But make sure that you do stretch your legs and you are not staying put on a chair or a couch potato all the time. Another thing is to put your arms in front with or without weights and turn at your waist on either side. So that way your waist will shift. Turn means not just your face, the whole body has to turn while the feet remains in the same place. The feet has to be there itself. Plus you can put your hands up and down, up and down. That's also there. All this helps. Seated piriformis is to prevent sciatica pain where you have shooting pain from the back to front. Sit and take your hands, take that leg, foot with one hand. While leaning forward, try to bring that foot towards your other side hip joint. So doing that again and again, that will loosen up your back muscles and prevent sciatica pain. Take a towel in your hand, try to put it on your foot and pull it down, take it up, pull it down, take it up. It will stretch your thigh muscles and give you strength to the thigh muscles. So when you are in the labor room, you will have strength in the whole body to go through that phase, big work called laboring. Bicep curls will give strength to your hands. Lift the hands with weights. While lifting, take 3 seconds. While coming down, take 5 seconds. Do it slowly. While taking it up, exhale. Keep your air out. While you take it down, inhale. Take the air in. So slowly do this 2 sets of 10 to 5 repetitions. So it will strengthen your muscles. You can carry your baby better and generally be stronger. While lying down, pelvic curl is something that you can do. You just lift your hip and your whole back up and put it down. That will strengthen your back muscles. So your back aches and all things, all that won't happen as the tummy starts coming out in the later pregnancy. Squats are the best things to happen and what you should be doing to have a normal delivery. Lean forward as you squat. So up and down if you do. These are half squats. As the pregnancy advances, you can do full squats. This, I think, is very useful for normal labor. As you get into the 4th month, the baby grows. In between the baby and the backbone, there are vessels. And they will be compressed if you lie on your back. So never do exercise lying on your back. Again, the BP may drop in second trimester. So don't change positions frequently, otherwise you'll start feeling giddy. So you have to be careful of all these things while continuing the exercises of the first trimester into the second trimester, which is month 4 to month 6. 4, 5, 6 months. So you can lie on your side, lift your leg up and down, all that you can do. Sit down, take your hands side towards your knee and push it down. Pull it, bring it back to your foot and again go back to your knee and push it down. So this helps to widen your pelvis, helps a normal delivery. As you go into third trimester, you have to do full squats. Either you can put your whole foot down or put the foot on a plank or something like that. Lean forward on a ball, hold a table or a chair because on your own, some people can't do it on their own. So you can take the help of some help, chair or table or something like that. But do squats. You should do exercises, mix the exercises. Don't do the say everything every day. Mix them and do 30 minutes, 3 to 5 days a week. Don't do it if you have chest pain, you have dizziness, lightheadedness, nausea, or vaginal bleeding. This goes for all trimesters. Hemorrhoids, vasa previa, placenta previa, or abnormal lie is another reason why you should stop doing exercises. Full squats should be done more often in the third trimester because that you are nearing delivery and you have to do more of this. Again, putting your feet apart and going up and down, that will give you stamina. Kegels exercises prevent urination coming out or strength to the pelvic muscles. That is, think that you have a pencil in your vagina and you're trying to prevent it from going out. So you contract your muscles around that pencil without contracting your abdomen and you leave it. Hold it for 10 seconds, leave it. So this will strengthen the pelvic muscles. So finally, exercising is good in pregnancy. Do not overdo exercising. Avoid in particular cases. I hope you enjoyed this video and you can take variations of this from various teachers. If you can do it supervised, that's very well. Thank you so for your patience.